thewellnesscouch.com, streaming wellness into your lives. Download the app today.
This is Up for a Chat with your hosts, Cindy O'Meara and Kim Morrison.
Here we are, up for a chat, talking about the hottest topics that are important to you, inspiring you to awaken the change within. I'm Cindy O'Meara.
And I'm Kim Morrison. Wow. You have no idea how excited we are to have this beautiful human with us this week, the amazing Dr. Charlie Teo. Now, he is a global neurosurgeon. He's a superhuman. He has an absolute passion for supporting and helping people. But more than that, he's an amazing dad. He's an amazing man. And he's also a beautiful human that we've come to really love and get to know. Welcome to Up for a Chat, gorgeous Charlie.
Well, I've never been introduced like that, but it was very nice, very personal.
Well, we feel very honoured that we got to hang out with you recently at the Mind Forum in Sydney and got to know you on a personal level. And I think that's a great segue into starting this podcast. The personal Charlie and the Dr. Teo, are they the same?
Yeah, look, some people say that I'm honest to a fault, and I think that's probably what's got me into trouble over the many years because I lack diplomacy. But a person once said to someone who didn't like me, "Well, at least you know what you're going to get." So yeah, absolutely. The Charlie Teo that you see in the media is the Charlie Teo in reality, is the very non-political, non-diplomatic person that I really am.
I was just wondering, how did you get into doing what you do and become so controversial? Was it because you were doing surgeries that no one else would do? But yeah, what made you say one day, "Oh, I'm going to be a neurosurgeon," and then what then told you to be a little bit of a cowboy? And I don't mean that in a derogatory term. I actually mean that in an incredible term where you were prepared to go out and do things that other people weren't prepared to do when it comes to surgery in the brain.
Look, the whole thing was not intentional. And look, it was all unintentional. A lot of people accuse me of, seducing the media and trying to be a celebrity and, gaining a high profile, but it was all unintentional. Very basically and very sort of naively, I thought that all doctors do what I did, and that is treat their patients well, with respect, giving them autonomy, putting their needs ahead of your own. And so, when I took the Hippocratic Oath, when I went into medicine, I just thought that, that's what you do. And yes, you're right. It turned out that I was doing things that other people wouldn't do and didn't do, but really it was never intended to be, I never wanted to be a cowboy. I never wanted to be, doing something different to everyone else. I just thought that that's what all doctors should do.
It's an interesting thought when it comes to doctors. I've met a number of them. I've had a number of surgeries myself. We know holistic integrative doctors. We know surgeons. We've had the pleasure of meeting many of them. Am I right in saying, and I say this with respect to the medical industry, but a lot of doctors don't seem to like each other. A lot of doctors seem to think that they're better than someone else, or that's not as good a surgeon as, I don't know, there just seems, with respect, there just seems to be a bit of an ego that can occur in this world. Am I wrong?
Oh, no. You're statistically correct. I mean, there's nothing false about what you said at all. If you look at the Healthcare Complaints Commission, if you look at the professional medical boards, you'll notice that, in fact, the majority of complaints are doctors complaining about doctors. So the APRA, for example, more than 70% of complaints received by APRA are doctors complaining about other doctors. They're mostly pernicious. They're mostly false, and they have no basis, and it's all caused by and resulting from jealousy of one colleague to another.
Sounds a little bit pig-headed. It's like, if you've taken the Hippocratic Oath, as you said, with respect, take care of the client, the patient, or make health the best thing that we can possibly have. How have you coped with that? Because remembering your story at the Mind Forum, it just blew me away that the person that made the complaint to the head of the department was actually the person writing to themselves.
Yeah, well, sadly, the governing bodies have been known to be lacking due process. Complaints have been made to human rights commissions. There have been, as I'm sure you're aware, several royal commissions. There have been several Senate inquiries, and every one of them, bar none, have come up with the fact that it's a very dysfunctional governing body. Oftentimes, as you alluded to, the plaintiff is the same person as the judge, is the same person as the jury, is the same person as the executioner. And in my circumstances, that's exactly what happened. The complaint that was received from Western Australia went to the West Australian representative on the national board, and that was the same person who then complained to himself about Dr. Teo. And then the letter was, should we pursue this? And of course, he said to himself, yes, we should pursue this. I know it sounds Machiavellian. It sounds like it's a hyperbole that, the whole thing's exaggerated, but I promise you it's all true.
I noticed that, and I'm seeing it more and more, that there's a protocol that is, I guess, adhered to in the profession. So if somebody has a heart attack, they're put on, something's done to them, and then they're put on 5 drugs, and one drug stays for a year, and another one might stay for 2 years, and the other one might be for life. And I'm actually noticing that with brain, like tumours of the brain, because I've had 2 friends now with glioblastomas. Actually, I've had so many friends with glioblastomas, and I want to ask you also, are you seeing an increase in this? And I noticed that the protocol for both of them were the same, even though we're very, very different people. And more recently, one of them has passed, but the other one has survived the 1.5 years, and they said they never do a second brain surgery. But because he's lasted so long, because he does carnivore, he has been operated on again to take the glioblastoma out. So is it the protocol that has to be stuck to? And did you not stick to those protocols, and that's why you got under fire? Am I right in saying that?
You're absolutely right, because we have to take it back a few steps. If you take it back to Archie Cochrane, the guy who came up with the whole concept of evidence-based medicine, he brought it up because he was a prisoner of war. He found that people on anti-tuberculous drugs were surviving longer than others who weren't on those drugs. And he thought that he would gather that data at the end of the war and come up with a paper that said that anti-tuberculous drugs improve survival. And what the modern medical fraternity has done is taken that Archie Cochrane story and turn it around exactly 180 degrees. And that is that you can't do anything until there's evidence to show that it works. Archie didn't do that. Archie actually started a trial himself and showed that it worked, and then he wrote the paper. But now doctors are so fearful of doing anything that is not already in the current literature. So, and I know you're sitting there thinking, well, hang on, that's weird, because you'll never do anything new. And that's exactly the problem. The problem is now, and, it's not totally the fault of the doctor. I mean, we are unfortunately under the umbrella of medico-legal concerns. And that means that every time you make a decision, you've got to think, oh, gee, am I going to be sued? So to try and protect themselves from being sued, doctors go, well, okay, I know how I won't be sued. If I get consensus, if I have evidence-based medicine to tell me that I'm doing the right thing, then they'll never be able to sue me because the literature is clear. Well, the whole terrible thing about that is that, of course, you're never going to do anything new. because you can't do anything new because there's no evidence yet to show that it works. And then, of course, the worst thing about MDTs, multidisciplinary teams, is that it holds the old dictum that a chain is only as strong as its weakest link. So all you need is some nerdy little non-risk-taking doctor who doesn't really know much to sit in that MDT and go, well, I don't think you should do that because his personality is such he can't take risks, or he doesn't know the literature, or he's just not that sort of person. Then, of course, you don't have consensus. And so, sadly, you're absolutely right. You end up sort of following protocols, which is exactly what a professional's not meant to do. The professional, you're paid to think and treat everyone individually. But it's hard to do that when you've got this cloud over you of colleagues wanting to destroy you, i.e. that figure I told you about, colleagues complaining about colleagues. You've got the fear of being sued, the fear of losing your reputation, and then, of course, you've got the fear of the media, i.e. Charlie Teo. And that is that, I've heard since over the last 5 years since it had happened to me, I've heard so many people say, well, why would we take risks? If they can destroy Charlie Teo for taking risks, they can destroy anyone. So I know amazingly competent neurosurgeons in Australia who I would entrust with my life, who are not taking out brain tumours now because they know that if they do something wrong, or if they do something that's out of common practice, then and they get a bad outcome, they're going to be absolutely crucified for it. So they don't do it. They biopsy tumours that they can take out, because biopsying is much less risky and it's not going to hurt anyone's feelings and it's not going to challenge the status quo. It's a terrible, terrible situation. And you're absolutely right about those examples that you brought up. And that is that, at the end of the day, the Professional Standards Committee found me guilty of two things. And one of them was operating on recurrent brain tumours. Well, it's ridiculous. I know Australian neurosurgeons don't do it, but if you look at the world literature, there's papers about repeat surgery for recurrent brain cancer. It's a well-known procedure that when you get a brain tumour that comes back again, there is evidence to show that reoperating is fine, but they don't do it in Australia. And because they don't do it in Australia, I had to toe the party line. I'm not doing it in Australia. Oh, it's terrible.
It must be so challenging for someone like you that wants to think so much for the patient, for the client. But one thing I do recall you saying at the Mind Forum was you admitted too that you, and I think the word, inverted commas, felt arrogant at one point, or you felt like you thought you knew more, as in at the time of whatever it was that you were doing. But you also owned the fact that you were open to learning more. You weren't, or naive potentially is probably a better word, but I do recall you saying that. How did you overcome the ability to get out of your own way?
That's a really good question, Kim, because no one's ever asked me that, so I'm not quite sure how to verbalise my response. But let me just tell you about the example, and then maybe that will give you some idea of how I overcame it. The whole medical system educates on a paternalistic basis. In other words, that you know more than the patient, you know more than a junior doctor, who knows more than a medical student, who knows more than a layperson. And that is our teaching. Because when you're a medical student, you're taught by these professors, and if you ever question the professor, then you are failed or you're certainly castigated for it. So the whole culture is that you regurgitate the information of your professors because they know better. Okay, so when that happens, you come out as a doctor thinking, gee, I'm pretty good, I've done 6 years of medicine or 7 years of medicine. I'm educated. I know this vocabulary that no one else can understand or speak. I'm pretty damn hot. Society puts you on a pedestal. You can do things that other people can't do. You can sign forms that other people can't sign just because you're a doctor. And so I hate to say it, but yes, you are, I don't know if arrogant is the right word, but you certainly come out thinking you're pretty hot. And so you start seeing patients and you've been taught this and taught that, and you've been taught that, you know better than them. So when you see a patient that you believe should not be wanting to stay alive, i.e. someone who's quadriplegic, for example. Okay, so this lady comes in, she's quadriplegic, she can't scratch her nose, she can't do anything. She just sits there, she can talk, she can breathe, and that's all she can do. Can't move arms or legs. She's got a brain tumour right at the craniocervical junction, which caused the quadriplegia. It's benign, but it was deemed inoperable by these neurosurgeons at a major teaching hospital in Sydney, and she was sent home to die, but she didn't die, she just became quadriplegic. So me, in my arrogant sort of manner, I think to myself, well, why in the hell would you want to live? Because, you think to yourself, well, I wouldn't want to live like that. You can't do anything. You can't walk down the beach. You can't scratch your nose. You can't do anything. So I arrogantly said to her, I can take that brain tumor out, but really, do you really want me to? I mean, and I was questioning her desire to live. How weird is that? I was questioning her desire to live. Anyway, so I thought I had the right to. I thought I had the right to at least inform her of my prejudices and what I believe quality of life is. Anyway, she just chewed me a new one. It was. How dare you tell me what quality of life is for me? She goes, I have 16-year-old twin daughters. Quality of life for me is the ability to transfer my wisdom and my knowledge to my 16-year-old daughters at a time when they need it. So the ability to speak and think is quality of life for me. Oh, my God. I went home and I thought about it. I thought, fuck, she's right. I mean, some people don't want to. I mean, quality of life for someone who is very active is, being able to run and being able to walk. But someone who is a couch potato who loves watching TV, if they were paraplegic, their quality of life would still be the same. And so here was I judging her idea of quality of life based on my criteria of what a good quality of life was. And that's arrogance. I mean, it's nothing else but arrogance. So why don't all doctors learn from their mistakes? I don't know. I think that's inherently in you. You're either an arrogant person or you're not an arrogant person. And, actually, that's not true because all those doctors out there just can't be born arrogant. I guess maybe they achieve arrogance. They become arrogant. Look, I don't know why I learned from it, but I did. I learned from it, and maybe it's my genes, maybe it's what my mother taught me when I was a kid. But yes, I learned from that mistake, and I treat all my patients differently after that. And I had another lesson before that, which I obviously didn't, I didn't think too much about it at the time. I saw the paraplegic lady because it was the wife of one of my good friends who was dying from breast cancer. Was it breast cancer? Anyway, cancer. And on her deathbed, she said to me, Charlie, you're going to become a doctor soon. I want you to learn something. She goes, never give up on someone if they haven't given up. And she goes, I know these people are well-intentioned. My best friend came and saw me yesterday and said, don't worry, so-and-so, I'll look after the kids for you. And what that said to her was that everyone had given up on her. In other words, they thought she was going to die, and they were reassuring her that when she died, they would care for her children, which was a lovely thought and a lovely thing to say. But almost by inference, it says that, I know you're going to die. I know you're going to die. And deep down inside, when you're on your deathbed, and all three of us here today aren't on our deathbed, so we don't know what people think, but I'm sure when people are on their deathbed, they still have that little bit of hope that they're going to be the exception to the rule and they're going to be the one in a million. And until you're actually dead, I'm sure right up until you're dead, you're thinking, hey, there's a small possibility I might make it. And then when someone comes and says something like, well, I'll look after your kids, it's like, oh, my God, they've given up on me, and I haven't given up. And so, yeah, I learned from that. I learned from the lady who was quadriplegic. I've learned from my patients. Stan Zemanek, I learned from him because Stan was a DJ, a shock jock, and the ability to speak was so important to him. And so when I said to him, Stan, I can keep you alive for a bit longer if you let me, if you let me operate again. But by operating again, I'm going to definitely affect your speech. He said to me, Charlie, speech to me is everything. And, I won't have quality of life if I can't speak. Conversely, I operated on a miner from up in Newcastle way, and I said, listen, I can keep you alive, but you won't be able to speak. And he goes, fine. My wife does all the talking for me. I go to the mines. I don't talk to anyone. I just do my work. I ride my bicycle there. I ride back again. And that guy was alive 4 years later, and from a cancer that should have killed him, within days or weeks. And he's still happy. Couldn't say a word. He could just say yes or no, and that was all he could say. And he still had quality of life. I'm telling you, this whole concept of quality of life is different for everyone. But doctors, sadly, start projecting their idea of quality of life onto their patients, and they make decisions based on that. So rather than give patient autonomy and say to a patient, okay, I'm going to respect your wishes, they go, I don't think you should live. I think it's futile. I'm not going to even give you the option. And they don't even tell them about the options because they're arrogant. Yeah. And sadly, I hate to say it, but it's not the minority of doctors. Doctors are going to doctors hate me anyway, so I may as well say it. But, it's the majority of doctors now. If you get a doctor who gives you autonomy and respects your decisions and is in your corner and is on your team, hang on to that doctor, because that doctor's a rare beast. Most doctors are very paternalistic, and they dictate what should and should not be done to you.
I've had my GP for 35 years. Kim goes to the same one. And I walk in, he goes, what do you need? He's so good. He just knows I'm a little bit alternative, and that he'll just go, what do you need? I went, oh, this is what I need today, So I found one, but the thing is, he'll probably retire in the next 4 or 5 years, so I'm not sure where I'm going to go. But
you've got to find a gem like that again. I'm telling you. I've got this collection of letters that I've kept over the years just to, when I give a lecture on complementary alternative treatments, and these are professors of neurosurgery saying the patient foolishly took some complementary alternative treatment, and I've told them that if they continue doing that, then I will no longer treat them. And oh my God, the arrogance! Oh. And it's all based on ignorance as well, because they don't know that these treatments don't work. And even if it's placebo, what the fuck? If placebo works, if it makes you live longer or takes away the pain, then that's treatment. Mm. And so, it's just.
I was reading the paper today, and the second page in, there's a meeting happening in Brisbane for Queensland Health. And it was just saying that, and the World Health Organization has said this, that by 2048, 88% of all people will die from a chronic disease. So they were talking about, like diabetes, heart disease, obesity, and they were just saying this is all preventable. But what gets me is when you go to a doctor, they never ask you, what's your diet like? What's your lifestyle like? What do you, how do you live? How do you sleep? How do you move? What's your connections with? Do you think that's going to change, or we're just going to stay with diagnosis and management with drugs and surgery? Or do you think
it's got to change? I mean, it's going to change very slowly because the medical fraternity is a behemoth of it's very slow moving, it's very conservative, it's very risk averse. So it's going to be very, very slow, but no, it'll change. Sadly, it'll take years and years and decades and maybe even centuries to change, but it will change, hopefully. But just remember this, I was one of those arrogant doctors. I was one of those doctors who, actually, no, I wasn't, because I learned acupuncture as a medical student, so I wasn't that bad, but I was certainly misinformed and ignorant of alternative treatments. Nutrition, for example. We were taught, no, I can't even, 1 hour of nutrition into a 6-hour course of medicine. So we come out thinking we know everything, but we don't know anything about nutrition and diet. But because we think we do, then if a patient came and said, I want to go on a carnivore diet or I want to go on a vegan diet, we would sort of laugh at them. Maybe not externally, but internally we'd laugh like, you don't know what you're talking about. There's no evidence about that. And we'd be very, very blinkered in our approach to someone's health. It is
I just want to
Apparently they
correct
don't
you.
get an hour now, but they get 1 day.
Well, I wanted to correct you because you said 1 hour in a 6-hour course. I think you meant 6 years.
6-year course,
Yes,
yeah.
yes.
It was 1 hour in a 6-year course.
But now it's 1 day.
About nutrition. I think they spend a whole day now learning about nutrition. It's crazy. It's crazy. So it's getting better, but it's getting better very, very slowly.
I heard someone say the other day, if you were given one car, let's say it's a Mercedes-Benz, and you were going to have it for your life, but it was the only car you were going to have for your whole life, how well would you get its service? How well would you look after it? How well would you make sure the right fuel went into it? How well would you make sure that this car lasted that distance? Yeah. Why do people not have the same faith or hope in the one body they get? Why do we put such faith and hope into medicine or into something being replaced? What's your thoughts around that?
Oh, you're absolutely right about that. I've got a patient who wrote a book going three quotes from a plumber. And it talks about that exact culture that you're talking about, and that is that we get 3 quotes from a plumber before we get work done, but we don't get 3 quotes from a doctor or a surgeon. You glibly accept a doctor as being, what they say is gospel, and as being, your savior. Well, things are changing. I think COVID help people realize that doctors may not necessarily advise what is best for you, but they are influenced by politics and by towing the party line. So that was the one good thing that came out of COVID. People were much more distrustful of their doctors because they saw what doctors were doing, and that is doing exactly what the politicians told them to do and not doing what was necessarily best for the patient.
So, I remember going in and being able to get ivermectin at the very beginning of COVID from our doctor. And my husband travels a lot to India, and it's considered one of the best, cheapest, most amazing drugs to support viruses. And I'm sure you could tell us a whole lot more. 6 months into COVID, we went back to get another 6 months supply of that or hydroxychloroquine, and it was no longer available. That is how much the political system interfered with what doctors could. And he wanted to prescribe it, but just said he couldn't. Okay. So when you think about that, another story, my grandmother, she's no longer with us, but when Granddad went off to war, and this is how much faith we have put in the medical system or doctors, and I understand that sense of arrogance or our confidence in them. She was told to smoke when Granddad went to war as a form of relaxation. And whenever someone says to me, doctors, they're the ones, I trust them, I'll throw in the word thalidomide and things like that. So I'm not saying, I don't want to make doctors wrong, but there surely must be an awareness within the medical fraternity that we don't always get it right either.
Sorry. Nope. It's bad. It's really bad. And again, I'm not saying it's them and not me. I was hoodwinked with the vaccine because I'm not an anti-vaxxer. Vaccines sound great to me, and they've eradicated so many terrible diseases. So as soon as someone mentioned a vaccine for COVID, I thought, oh yeah, why not? It's great. Because I didn't look into it. I didn't look into the science behind it. I didn't realize there was a gene therapy. I had no idea that companies could come out with a vaccine that wasn't trialed properly, that taught a vaccine, but it actually was never a vaccine. I mean, it is just another aspect of fake news. And again, the one thing good about Trump, he sort of popularized that term. I mean, I know he didn't coin the term, but he certainly popularized it. And it's a great way of, looking at life now. You've got to be a little bit more circumspect. You've got to question. And I never did that. For example, I used to think the media couldn't lie. I mean, how crazy is that? I used to think that there was always an element of truth, and there had to be an element of truth behind any media story, or else they'd get sued. But it turns out that they can make complete lies. They can fabricate complete stories to their own agenda, so they get clicks, and they sell papers. And I was so naive. I thought that they couldn't do that. I thought there always had to be some element of truth. I mean, how crazy is that? And what about I'm an ambassador for Orangutan Foundation International Australia, OFI Australia, and when I was over in Borneo trying to save the orangutans, I realised that the major problem with orangutan extermination is that we are taking away their forests. And what's taking away their forests? It's palm oil. Okay, so I started reading up and learning about palm oil and how bad it was and everything. Anyway, again, it sounds weird, but there was a legislation that was trying to be passed through Parliament, and it was called the Truth in Labelling legislation. And all it said was that we insist and we legislate that people, when they write advertisements on their products, it has to be truthful. Do you really have to write a law about that? Anyway, and it came up with palm oil because when everyone knows how bad palm oil is now, but you don't have to call it palm oil. You can call it vegetable oil or whatever. And you don't even have to report on it. You don't even have to say it's in the product. Well, there was bipartisan support for the truth in labelling law legislation, but a party of 11 billionaires came out from Borneo to lobby the Australian government about palm oil. And of those 11 billionaires, 9 of them were billionaires because of palm oil plantations. And after they came out, when Parliament next sat, the truth in labelling legislation was failed and wasn't passed. Yet before these billionaires came out, these palm oil billionaires came out, they were all supporting it. So, what do you think? You can't help but think that maybe they were bribed. Oh my God, really? A politician being bribed? And again, I've been very naive all my life because I've always thought, I always think the best of people first, and you always judge other people like you would think. Like, if that sounds incredibly wrong to you, then of course you'd think that it would be wrong for other people as well. And so you don't believe that someone could be so corrupted and so nasty that they would let a billionaire paying them under the table a bit of money would stop you from voting against the legislation that makes common sense. And Julian Assange, for example, what if a person from outer space came down and said, "Oh, that Julian Assange guy, why was he incarcerated for 12 years or whatever?" "Oh, because he told the truth." It just doesn't make sense. Well, why is Charlie Teo unable to operate on Australians in Australia? "Oh, because he was too optimistic." And he did things that other neurosurgeons don't do, and his results are better than other neurosurgeons because he specialised in brainstem tumours, and his results are so good that his outcomes are better than everyone else's, and that's why he can't operate anymore. Just the whole world. Sadly, it doesn't quite make sense anymore.
You were named Australian of the Year, is that right? At one point?
No, I've been nominated as Australian of the Year, but I've never won it. There's too much. But too many people against.
So I find it fascinating that you've been nominated, that they see you as fantastic, and yet there's this other side that you've been vilified to the point where you can't even operate in this country.
Oh, Kim, it doesn't make. You know why the public have supported me? Because it never passed the pub test. And so for 25 years, I was lauded and congratulated by the by the Australian community for saving lives. And there was all these stories about people who were sent home to die, and I took their tumours out, and those stories were just so common. And then suddenly, overnight, I become this villain who only operates for money and personal reputation. And, I operate on the wrong side of the brain. I'm a sexual predator. I'm money hungry. I'm this and that, all the things they came up with overnight. And I think the public go, hang on, how can someone change like so suddenly? And look, all I can say is it just doesn't make common sense that, the whole world now want me to operate. I'm operating on, all these VIPs from around the world. Every country allows me to operate except my own country. And Australians are travelling overseas, and they're coming back with these great stories of how they were told to go home and die, and I've taken their tumours out, and they're still alive years later. And so I'm still doing what I always do, and yet I can't do it in Australia. It just doesn't make sense.
I'd like to pivot a little bit, because I believe your technology that is in Australia and what you talked about at Mind is mind-blowing. Would you like to talk about how the technology to help the brain? I know it's the brain, but I can't verbalize how the technology works. Obviously, a very brainy person has put that together, as you talked about. Can you talk about your legacy? That's the way I see it, an amazing legacy, and the funding you've got for it, which blows me away, how well you did to fund it so that it would come to pass, that we could help children with autism, children, I think, nonverbal.
It's a lovely story, and I think hopefully when your listeners listen to this story, they won't focus on all the negative stuff, which I've just been, blabbering on about. And I apologise for that. I mean, I don't like talking about the negative stuff, but I must say that it still stirs my blood, and I still get angry, and I still get... Anyway, so you're right, let's pivot. Let's not talk about the negative stuff. In fact, what I'd like people to learn is that as one door closes, another opens. And cream always rises to the top. So, and that which doesn't kill you makes you stronger. I think that's the take-home message. And so the nice story that comes of all of this is that when I could no longer operate, instead of working 120 hours a week on 10 brain tumours a week and being incredibly busy, I found myself having all this time. And the story you're talking about is the story of Mike Shagru. So Mike Shagru is a neurosurgeon from America who trained with me many years ago, was disillusioned by the American health system and asked if he could come back and join me. And so here he was sitting in my office. I couldn't operate, which means he couldn't operate, and he had a brilliant mind. And I go, Mike, I know what we can do. The Human Connectome Project has given us information that very few people can actually comprehend. So the Human Connectome Project was this project started by the American government to map the brain and to explore the last frontier, i.e. the human brain. But the paper that came out of it, published in 2016 in Nature, was very esoteric, and certainly the average doctor could not take that information and translate it into patient care. But Mike, being the genius he is, I said to him, can you take the Human Connectome Project and turn it into an app? And he goes, yeah. If you give me the appropriate support system, I can do it. So the appropriate support system was to gather the world's best data scientists, put them in a room with Mike, get the funding for that, and within 6 months they came up with an app. That app can now basically scan any person's brain and show how the brain is working, not just how it looks. Like an MRI scan and a CT scan gives you structural information, how the brain looks, but it doesn't tell you how the brain's working. we have tried desperately over the last few decades to come up with scans that show how the brain is working. And so the concept of functional MRI scans has been around for a long time, but it's always been task-based. In other words, the patient has to perform a task, and that shows you where that part of the brain is active. It gives you very limited information. It certainly doesn't give you information about your higher cognitive functions. And what are the higher cognitive functions? They're the things that make us human. The ability to relate to others, empathy, imagination, pleasure, all those things are your higher cognitive functions. And Mike and all these geniuses can now show on a scan where those parts of the brain are and if they're working properly. And so if you think about that, it's going to change the entire landscape of brain disorders. I'm talking psychiatry, neurology, neurosurgery, psychology, anything to do with the brain now can be mapped, and you can actually see it in a tangible fashion. You can actually see these areas of the brain that are overactive or underactive, and compared to a normal person's brain. And then you can modify or modulate those abnormal areas using interventions. So those interventions can be anything. We have to use transcranial magnetic stimulation, which is very non-invasive. It's very safe, and it can actually stimulate or inhibit different parts of the brain that are overactive or underactive. But you can use other modalities as well. You can use psychogenic drugs. You can use psychedelics. You can use complementary alternative interventions like light therapy, breath work, cryo, HBOT. All these things have the ability to change brain networks and how the brain is actually working. The good thing about TMS is that you can be more specific, patient-specific, because these maps actually tell you not just where the lesion is, but they tell you if it's overactive or underactive, and it tells you to millimeter accuracy where this problem is. And TMS can then, TMS combined with frameless stereotactic guidance can then target these very small areas and modify them.
It's pretty powerful.
So it's amazing. It's absolutely amazing.
At the forum, you also talked about, and again, you're going to have to correct me because I didn't have notes on it, but there was something about there was a specific number of parts of the brain that you knew of, and then with the Cingulum, this new beautiful therapy, we found out that there was multiple more layers. You could even tell where, depression sat, where anxiety was sitting. Like, what was the numbers that it went from to that just blew your mind as to how much
the original map of the brain was designed by a guy called Brodmann, and he talked about 47 eloquent areas of the brain. Those parts of the brain that didn't get a number were called non-eloquent. In other words, I guess that was a euphemism for, well, we don't know what those parts of the brain do. And so people like me would glibly come along and sacrifice those non-eloquent parts of the brain, thinking that we weren't hurting patients. But honest practitioners would self-reflect and think to themselves, well, hang on, that patient may have been able to walk and talk and speak, but they were no longer the same person. They had some very subtle change in their personality, and I did that. I did that by damaging the non-eloquent part of the brain. And if you then accept that your surgery or your glib acceptance of non-eloquent parts of the brain being superfluous, if you accept that that is wrong, then you go, holy shit, what do I do now? I've got to make sure that I don't damage parts of the brain that control these subtle higher cognitive functions. And how do I do that? Well, I get these maps. And these maps will show exactly what you're doing. So sadly, that hasn't been adopted in Australia, but the rest of the world have adopted this technology. We have 65 universities in America all using this technology to get better outcomes from their neurosurgery patients. And that means that not only do we map motor, language, vision pathways when we do an operation, but we also map other pathways that were previously unknown. Pathways called the central executive network, default mode network. These are pathways that control those subtle functions of a person's personality or character that can have just as much negative impact on their quality of life as a paralysis, say. Using these maps, we can now refine our surgery so that the complications are less, and the patients can be better informed about potential complications before surgery.
And why has Australia not adopted this? This just sounds crazy that it wouldn't do this. No, you're not shaking your head.
I don't know. It's terrible. All I can say is it's terrible because some doctors have. There's a very good doctor down in Melbourne, and she is a great proponent of connectomic-based surgery. That's what it's called, where you map these sensitive areas. But by far the majority, well, apart from her, there's no other neurosurgical unit in Australia that's using these maps to refine their surgery and to reduce the risk of damage to these high cognitive networks. It's available. Don't even ask me. I don't want to. I don't want to bring up anything negative. But the positive thing is that this technology has been sold to Yale, Harvard, Johns Hopkins, University of Miami, all these, illustrious universities in America. And the good news is that they are so thrilled with these new maps designed by Mike Shagru that they have resubscribed to the company and to the software.
Nellie, was it from 47 then? And I'm sure you gave a number as to how many more.
389.
389.
But it's very dynamic. It's changing all the time. But yes, we call them parcels, and it's called parcellating the brain into these 389 areas that subserve different functions.
Mm.
And you're right. Now, because of this added knowledge, we now know which parts of the brain control things like, sadness and happiness and empathy and things like that. Yeah, it's fascinating. And it would never have happened if I continued working as hard as I was working, doing 10 brain tumours a week. So I'm not going to mention her name, but to that journalist who brought me down, all my family and friends say to me, one day you'll be thanking her for what she did. I'm not quite at that stage yet. I'm not a Nelson Mandela, but if I was a Nelson Mandela, I'd be thanking her for what she did to me.
I'm sure there's a part of you that is. I'm curious to know, how much are your hands insured for?
Well, they were insured for over $1 million when I was practicing neurosurgery in Australia. But now that I'm practicing overseas, I'm mostly operating in China, and they do my insurance for me in China. So I don't know how much they've insured me for, but yeah.
When you think about how much medicine has evolved, and let's give kudos to the way that it has expanded in many ways in its thinking, what is your thoughts around robotics and the integration of using AI in medicine?
Oh, AI is actually very integral to what this company, Mike Shagru's company, does. Because to develop those maps, they had to use 23 machine learning steps and AI to develop those maps. So AI is definitely very, very important when it comes to advances in medicine. In terms of robotics, I think it'll get to the stage where it'll be sort of like almost normal. It's almost like that with prosthetic surgery, as I'm sure you know. And, whether it will come into neurosurgery, I'm not quite sure, but I would like to think that robotics will help us in neurosurgery one day as well. The hardest thing about robotics is that, they can do fine movements, but it's that haptic feedback that's very difficult to get. The feedback of resistance when you're touching something. And if they can master haptic feedback, then I think the world's your oyster. It'll expand pretty dramatically.
You mentioned John Hopkins has adopted your technology. And John Hopkins, for me, has been a place where they were very innovative when it came to seizures. So I don't know if you've seen the movie First Do No Harm, but it's about a young boy who's having about 140 seizures, and they've just got him on every medication, and he's just getting worse and worse and worse. And the mother does research and ends up at John Hopkins with a dietitian called Millicent Kent, and starts the ketogenic diet. First of all, fasts and starts the ketogenic diet, and that child has never had another seizure. He was about
I know that story. It's a great story.
It's a brilliant story. And I just kind of go, it's really cool John Hopkins is now also doing this, because what we seem to have at the moment is neurodiverse. So not just seizures, but we have this neurodiversity that, with autism and ADHD. And like lately, like I was at a business seminar over the weekend, and the amount of women that stood up and said, oh, I've been diagnosed with ADHD. Like they're in their 40s and 50s being diagnosed with ADHD. Is that coming from the brain? Where is that? Why is it all of a sudden a new diagnosis for women?
Again, my confession is that I never used to have much respect for mental health problems. And I was never as bad as Tom Cruise, but I was pretty bad. And by that, if I ever heard of someone getting depressed or down, I'd go, oh, just get over it. Just get over it. Again, all from ignorance. Now that I'm more educated, and now that we've seen these maps and actually can see a tangible, discernible, obvious lesion in the brain, I now appreciate the fact that it's a disease like any other disease. When we see these lesions in the brain that are overactive or underactive, it's like looking at a tumor, because when we treat them, they disappear. And that correlates with patients getting better. All those diseases that have just been defined, PANDAS, PANS, all those diseases that we never even heard about or learnt about in medical school, a lot of them do have as a common substrate a brain disorder, some sort of neurocognitive disorder, probably on the basis of some sort of chronic inflammation, sometimes infection, sometimes stroke or hypoxia, but some sort of brain disorder underlies a lot of those conditions. And to the defense of most doctors, again, we're taught about evidence. And when you get a patient that comes in and you scan them and it's completely normal, it's almost like, well, there's nothing wrong with you. I've scanned you. I've done your blood tests. I've done this. I've done your ESR, done your CRP. You're all normal. Go away. There's nothing wrong with you, or it's all in your head. But now, thankfully, with these maps that Mike Shagru has developed, the company is called Omniscient. Thankfully, because of this company called Omniscient, we can now give those naysayers something that they can actually see that's tangible, and hopefully that'll change their way they think about mental health, ADHD, ADD, depression, anxiety, PTSD, tinnitus, all these conditions that we could never ever objectively quantify or quantitate. We can now do it with these maps.
And once you've found it in the maps, then there's the technology that you're using that can help these people with ADHD or autism, hypoxia. And the reason I'm asking regarding the hypoxia is that my granddaughter had 21 minutes without oxygen after birth. She's doing really well, but there are a few things that she's not, doing her milestones. But you can't put a 4-year-old in an MRI for a long time. You'd have to wait till she's older. And then once she's older, is it better, or when she's younger, is it better?
Well, the younger you are, the better, because your brain's more plastic as you're younger and your brain's still developing. So, yes, it would be, if you're going to intervene, the better time to intervene is when you're first diagnosed or when it first happens. So TMS for stroke, for example, has been shown in 33 studies to be effective, but the sooner you do it, the better. You've got to do it within 3 weeks to 3 months of the stroke. And sadly, again, a lot of doctors have not accepted TMS as a treatment for stroke, so they don't even inform their patients of this possibility. And so a lot of patients see us, I had a stroke 3 years ago. Well, it might work, but sadly, it would have been good if you'd come to us 3 weeks after your stroke, not three months. That's the first point from your story. The second point from your story is that I want to be optimistic, okay? I want you to understand that things will get better. At the moment, yes, it's hard to scan a 4-year-old because you can't sedate them. If you sedate them, you change the functioning of the brain, and you get misrepresentation on these scans. Not only that, when we assess your brain, we like to compare it against a normal brain to show that, you've got abnormalities. Well, the repository or the bank of normal brains are mostly adults. And so you're probably going to get a little bit of misrepresentation comparing a 4-year-old's brain to a 30-year-old's brain. But the optimism is that, it's going to, the more people we scan, the more time we've got this technology, the better we are going to get at it. So I can see probably within the next 10 years that we will be able to scan a 4-year-old without sedation because it will be done very quickly. We'll have enough 4-year-old brains in our repository to then compare that person's brain, and we'll be able to intervene at a whole lot earlier age. The whole concept is that you've got 100 billion neurons in your brain. And that old saying, you're only using about 10% of your brain at any one time, is probably true. You've got a lot of reserve. And that's what plasticity is. Plasticity is where, the brain never heals itself. It can't heal itself. Once it's dead, it's dead. But what it does is it recircuits, and it uses this reserve, and that's called plasticity. So the hope is that even that 4-year-old with a hypoxic brain injury still has enough neurons that if you can recircuit it, or if you can help it change the pathways, it will bypass the damaged parts of the brain and the brain will become more functional.
I think that came to light in that book, The Brain That Changes Itself, and that the father of the medical doctor who, had that stroke, and then, 8 years later when he died, they did that autopsy and found he was using 3% of the cerebellum or something.
Look, there's always these figures that you bandy around, but if you don't mind, I'd rather not mention that, because I do know that the more we've learnt about the brain, the more we realise we don't know about the brain. And so I have no idea what's happening with all that so-called reserve brain. I'm sure it's being used, but we'll have to do more work on it to know exactly what's happening.
It's a bit like genetics, isn't it? They said, you've got a whole bunch of junk genes.
100%.
We're like going, junk genes?
Yeah, they've got to do something. I know. And absolutely. I mean, and that was why they did the Human Connectome Project, because of the Human Genome Project. How do you know what abnormal is unless you know what normal is? And the beauty of the Human Genome Project was it just opened the doors. It just turned on the lights so that we knew what abnormal genes were, because we suddenly mapped a normal gene profile. And that's what's happening with the brain. The Human Connectome Project was a brilliant project that said, surely 1909, Dr. Brodmann, and compared to, 2025, things are got to be a bit different. We've got supercomputers now. Surely we can do something with them. And that's what we did. Yeah.
Charlie, I'm just curious, backing on the story of Cindy, you're talking about doctors against doctors. There's also been a real rise in mothers against mothers, whether you do vaccinate, whether you do things or don't do things. And a lot of mothers seem to be, at each other as well, or there's judgment around it. A lot of beautiful women, intelligent women and men are listening to this podcast. I would love to know your thoughts around mother's intuition. We may not be scientists, we may not be doctors, but we know our children. And often we can be overridden by fear or media or medical worlds to not trust that intuition. I'd love to know a message or a thought to you to give us hope, us women, us mums that aren't medical specialists, what you think about us in our intuitive knowledge.
Yeah, because remember, intuitive knowledge is just a way of combining all your instincts together. And so that intuitive knowledge comes from your own experiences, the way your child behaves, the way they interact, what they're eating, how they're sleeping. You've got this supercomputer in here that takes all that information, then spits out something. But that intuition is a huge amount of data being processed in milliseconds. So we are taught as pediatric neurosurgeons that the mother is always right. So if a patient comes in with a shunt for hydrocephalus and they have these really weird, odd symptoms, as they often do, even if the scan looks normal, even if those symptoms aren't in the textbook, you've always got to just believe the mother. So if the mother says that, oh, look, I think there's something wrong, listen to her and even operate based on that. And, I've done hundreds, if not thousands of operations based on that premise, that the scan looked good, the symptoms were kind of weird. I'd never heard of them before, but the mother goes, I think there's something wrong with this kid's shunt. And lo and behold, you take him to the operating room, you disconnect the shunt, and it's blocked, even though the scan never changed. You've got to put a lot of credence on mother's intuition because they know best. And they know best because they've got this supercomputer that it may not be the symptoms, it may not be how they look, it may not be how they move, but if we put it all together, it means something.
That means a lot to us women, doesn't it, Cindy?
Yeah.
Well, it does mean a lot, but the sad thing is that doctors often don't respect a mother's intuition, and we force them to vaccinate their children even if they inherently don't want to do it. And I can see both sides of that story. I mean, one side of the story is that vaccines have stopped us from getting all these terrible diseases, number one. And number two is that, if something goes wrong, you're going to take that kid to a hospital and that kid is going to be, spending taxpayers' money. So I'm sorry, but you've got to do what the government says you're going to do because you're going to depend on the government one day. So I can understand why people insist on vaccines and insist on this and that. But, sadly, if we come back to our original statement, you can't always trust doctors and you can't always trust governments. If you could trust doctors implicitly and trust governments implicitly, then sure, do what they say because they know best and they're doing it for your best interest, not for their best interest, not for money, not for gain, any other gain. They're doing it because they believe it's the best thing for your child. And if we could depend on our politicians and doctors doing what's right for the patient, then yes, absolutely you should listen to them. But like I say, unfortunately, COVID has proven to us that is not always the case.
Yeah. I just want to go back to the vaccination issue. So when I was growing up, we walked to our vaccines. We're 5 or 6 years of age and we had them at school and we had 1, maybe 2, and that was it. But I look at the schedule now and that's what scares me, is how many things that we are being vaccinated for. So I decided Medicare sends out a letter to mums and says that it's the easiest, safest, effective way of, making sure everything is fine as far as stopping infectious diseases. So I thought, right, I'll ask the government if they've got a safety study on the schedule, not the individual ones, but the schedule. So I've been going on this 6 months, Charlie. So I'm with Mark Butler at the moment. I'm in his offices, which is Minister of Health. So far, they've sent me why people are not vaccinating. They've sent me, if I want single vaccines, I would have to get a freedom of information for the safety. They've sent me a survey. They've sent me some propaganda with no study whatsoever in it. They've sent me 5 ingredients, and then I sent them a list of the ingredients that I wanted the safety study on. Now I'm hearing crickets. I just said, look, just give me a yes or a no. Do you have it or don't you have it? Because it's important to me as a grandmother that my kids, it's got to be fine. And I think it's all happened because of COVID, the safe and effective. That was never studied. So then I thought, well, if that's not studied, has the schedule been studied? The government can't give me that study. You'd think they'd be able to pick it out and go, here you go. And yet in that Medicare letter that they get 4 times a year, if you're not up on your vaccines, like let's say you've delayed your vaccines or you haven't done them or whatever, you get a letter that says it's easier, safe and effective. So I thought, well, they must have the study, but they don't. Like I'm 6 months in, like 5, 6 months in. We're now June, I started in January. What do you think about that?
Well, again, if you don't mind, I'm not an expert on vaccines, so I don't want to make a comment about being an anti-vaxxer or being a vaxxer or not. But I'd like to make some general comments. And the general comment is that I used to be one of those people who glibly accepted what my governing body told me to do because I thought they thought like me. And that is they would only give me information or only tell me what to do if it was the best thing for my patient. And, we have all learnt now through social media or through COVID or whatever that is not the case. So I've now become not an anti-vaxxer, but I'm certainly questioning what I'm being told is right or wrong. Is it right for you and the government, or is it right for someone's pocket, or is it right for the patient? And so that's my general statement now. My general statement now is that question everything. Question everything. And I think you're doing the right thing by questioning them because, history has told us that we should question them. And when it comes to neurosurgery, for example, I can tell you now, anyone else out there is listening who knows someone with a brain tumor or has got a brain tumor, sadly, I can tell you now that most doctors, if not all doctors, are treating their patients based on their own survival, not on the patient's survival. In other words, why would we take a risk when we not only don't we have to take a risk, but a precedent has been set. The precedent was this, that I told my patient that the risk of brain stem surgery, glioma surgery, was about 6%. Why? Because I published a paper showing it was 6%. The tribunal came down and said that I should have told the patient the risk was 70% because all those surgeons on the tribunal who had never done a brainstem tumor before said that the risk was 70%. So I was then mandated, I was told that I had to tell my patients that the risk is 70%, even though the risk is 6% in my hands. Mm. So what that means is that when this surgeon comes and tells you that the risk is too high to take that tumor out and we're just going to do a subtotal resection or we're going to do a biopsy or we're going to take out what's safe, okay, question that. Question that because, that surgeon probably has the skill to do a more appropriate resection. And the appropriate resection is to take it all out. And so you've got to say to that surgeon, I want to know the figures in your hands. I want to know what you would do if my child was your child. I want you to tell me what you'd do if you didn't have any fear of being sued or being persecuted by your colleagues. What would you do? And get second opinions and third opinions and be more proactive and be more
lioness.
Yes. Yeah. Yeah.
That's a medical term.
Yeah. Don't glibly accept things that you hear as being gospel and that they are necessarily doing it for your best interests or your child's best interests. So that's all I'm going to say because, I don't want to come across as an anti-vaxxer. I'm not. I'm a scientist. I've seen what vaccines can do, so I like them. What I don't like are things that are called vaccines that aren't. What I don't like is where they haven't gone through due process and tested them appropriately. What I don't like is where the complications of that medication is worse than the actual disease itself. And, we know now from that paper that if you're less than 55 years of age, the cardiac complications from the vaccine were greater than the complications from the infection. And we knew it at the time. And our governments would have read that paper, and yet they were still telling us we needed to be vaccinated, and if you're less than 55. So I guess just be more educated and don't be so naive when it comes to governments and governing bodies.
And I guess that's what I'm trying to do, is that I want the paper.
That's what you're doing. You're questioning.
Yeah,
and you're not getting answers. Well, that should raise red flags to you.
It should, shouldn't it? You think,
oh, yeah.
Don't worry, I'll pursue. I've called them twice now, and I keep emailing them, say, have you got the study? Can you answer me? Anyway, I'll let you know.
If raise red flags. If they're not giving you straight answers, something's wrong.
Yeah.
It's like a doctor who gets upset with you when you ask for a second opinion.
Yeah.
That should be a red flag immediately. If he's doing the right thing by you, if he knows the literature, if he's an expert in his field, he would want you to get a second opinion because it'll make him look good. I know more than that person, and I'm the expert. So go for it. Get as many opinions as you like. But a doctor who gets a little bit threatened or gets a little bit antsy because you're getting a second opinion, or you come up with some suggestion, they put you down because you came up with a suggestion that garlic might help. Question that should raise red flags. Because when someone says to me, I've heard that slippery elm bark might help my brain cancer, I don't go, you're an idiot. I go, oh, really? And I'll go and look at the literature, and I'll read about it and try and understand it. And so that's the sort of doctor you should. Oh, here I am I'm the sort of doctor you should. No, you know what I mean. The sort of doctor you should respect and believe is the sort of doctor who keeps an open mind, who gives you respect, and doesn't put you down, treat you as an equal, an intellectual equal.
It's interesting, and I know we'll come to a close very shortly. We're so appreciative of your time. But when we look back on our forefathers and mothers and come from a historical point of view, there's these plants, a lot of medicines have come from either experience or the plants or Mother Nature herself. And I feel like what you're saying is to question it with validity. There is a lot of literature out there, not always shared. But also, I think from my perspective, slippery elm or any of these beautiful homeopathics or tinctures or balms and things like that, because there's no patency or you can't actually make a hell of a lot of money off it. I had a chiropractor who was also a nutritionist and a biochemist said to me once, if you're unsure, follow the money trail. And often these medicines, there's not a lot of money. And so I kind of understand it, but it comes back to that inner knowing, that intuition, following people like you, which is a segue into how do we follow you and Singulum?
Well, if you want surgery, you just have to come to China.
We're on our way.
I know it sounds bad, but it's actually not that bad. They've built this fantastic hospital for me. I've got the best equipment in the world. It's on the same time zone. It's cheaper than having surgery in Australia, significantly cheaper. The care is magnificent. Nurses actually care about you. They give you massages. They buy food for you if you're. It's just I'm so thrilled with the way my patients are being treated in China. That's for neurosurgery. If you've got a mental health problem or any other neurological problem, and you're sort of at the end of your tether and no one's listening to you, then we have a clinic in Sydney called Singulum, Cingulum, Singulum Health, and it takes a very holistic approach to patients. We look at the whole picture. We combine that with science, the great work of Mike Shagru. We scan people. And we're not arrogant about it. We search high and low for the best treatments for that person. And again, even if it's slippery elm bark or garlic or ginseng, so be it. And I'm very proud of myself for that, because not only am I a scientist and a professor of neurosurgery, but I'm also an acupuncturist. And so right from when I was a kid, I always understood that there's more than just Western medicine. Eastern medicine had a lot to offer us, and so I've always tried to keep an open mind to and holistic approach to patients, and the role of things like diet. the microbiome, heavy metals, being one with nature, sleep. All these things are just so important, and you're not taught any of those things in med school.
Music to our ears.
We love you. We love you. And also, so we'll put all that in the notes, how to follow you. But I just want to say on behalf of both Cindy and I and our beautiful listeners, thank you for being the human. Thank you for taking one for the team by being, almost been ousted. Well, you have been ousted of this country to perform surgery, but you're still doing it and still showing up. Thanks to that amazing Mike and your team. And I also want to say you're treating my mum down there in Sydney through Singular.
Yeah, I didn't put the two things together, Kim.
I know.
But yeah.
and she doesn't trust anyone, and she thinks you are the bee's knees. And I just want to say, she said last time, whether you said it or not, but Charlie said to give you a kiss. Well, I'm taking it now. So I just want to say thank you for all that you give and do. Cindy and I just love you. We appreciate your story, your humanistic way of looking at life, and also your vulnerability to open up about what it means to continuously expand as a human, which is to really look at all avenues and have a very open, expansive heart, mind, body, and soul. We love you. We appreciate you. And we thank you so much for being on Up for a Chat.
It's lovely. Thank you very much, Cindy. Thank you very much, Kim. It's been a real pleasure. And hopefully we'll interact more in the future.
This has been a production of TheWellnessCouch.com. Check us out on Facebook and join in the conversation on Facebook.com/The Wellness Couch. Subscribe to each show on iTunes and check us out on Twitter. The Wellness Couch, streaming wellness into your lives.
Whilst the Wellness Couch presenter endeavor to provide accurate and helpful information to their listeners, these podcasts cannot take into account individual circumstances and are not intended to be a substitute for health and medical advice from a qualified health professional. You should always seek the advice of a qualified health professional before acting on any of the information provided by any of the Wellness Couch podcasts.